All right. So there's probably two parts to this, where one is the patient's total activity level, and then the other part is the journey within our MTP ecosystem. Now, so if you think about a person's activity level as being sort of high, medium, and low, um, generally the things, if they've got high activity level, they're highly engaged. They can, play sport, exercise. They're not limited. They've got low limitations on what they can do physically or generally. If someone wants to go rock climbing, you can choose to go rock climbing. If someone wants to do a fun run, you can choose to do a fun run. If you don't want to do any of those things, you can choose not to do those things, but it's a choice. For medium level activity, then your choices go down. Choices are reduced. When you have very low activity, then your choices are like exponentially reduced in terms of choices. Now, what tends to happen with people's experience with joint pain is they kind of go on this downward spiral. So they might start up here being quite active, and then they gradually go downhill in terms of their activity level. And so if you spotted like what are the things that people love doing, some people will cut off here. It might be like playing with grandkids. Some might be hiking. Some might be like, I don't know, just walking dog, right? And so depending on the person's capacity, this person's probably going to get further down the post of activity level before they see a surgeon or before they seek help. Somebody's like here is probably only going to get to this point before they start to seek help. Irrespective, wherever they seek help, increasing their activity level and therefore their engagement in life, their experience with their loved ones is the goal. And so if we then return this concept to our experience, so let's say whatever point that is, there's this critical threshold where patient seeks help, right? So the patient comes in and they have a consultation with somebody at MTP. So first MTP consult, and that might be with a surgeon, it might be with a physio, it doesn't actually matter. From that moment, the goal all the way along the continuum is movement and actually increasing their activity tolerance so they can do more of life, right? And to it. So irrespective of where they start, that's the objective. So we want to maintain that. So exercise is always present, and it's always that main focus is their movement quality, their movement capacity, and their ability to engage in life. Now, if on their first consult, pain is way up in the sky, well, then they need to manage pain. So things that you might start with are things like, pain management, which are like your injections, bracing. It might just be manual therapy, MT physio. It might be surgery down the line, right? If those things don't work, if you've tried physio, you've tried some bracing, you've tried some injections, you've tried radiofrequency ablation, and every one of these loops back in to movement. They're just a facilitator to continuing to engage in this exercise continuum. If they don't work, then you go to the next thing. You might then try this thing. If surgery, after you've had surgery, if that's what's required, you're still looping back into movement and back into exercise. And this isn't like an exercise demand spectrum. This is a continuous level of some exercise based on your needs and your capacity and time. So the idea is that the goal is movement always, all the way, irrespective of the level of the person's function. Their goal is to have more function than they have now, usually due to pain or some other limiting factor. So we address those factors that limit their ability to engage in more movement to allow them to continue to do movement and keep building and building to then level back up wherever they want to be for their life objectives and their life goals and their life engagement. So a continuum of movement to increase activity tolerance to do more of their life. And these interventions become accessory kind of adjunct treatment options where you go out and back in to manage symptoms to allow you to do the things you need to do to improve your activity.